Kei te mihi tuatahi, ka nui te mihi ki a koe e Mark, I te ropu o Body Positive. I te karanga o te kaupapa o tēnei rā HIV. Tēnā koutou katoa I ngā pia pono. He tino haere koe te nākau I ngā tautoko te kaupapa tēnei rā. Ko Waio, who am I? Ko Ngāti Whātua, ko Ngāti Hāmua, ko Ngāti Kuki Aireni I ngā iwi katoa. He moko puna ko Ngāti Whātua no Kaipara Tāmaki Makaurau. Ko Project Manager, ko te Hira Program, Data and Digital Directorate, te Whatu ora. Ko Manu Sione ahau. Kia ora.
Tā alofa lava, mā lole soifua maua, malangi mama. I'm Sarona, Aiono-Iosefa. I'm business partner for Hira and DE&E. And it's a business partner for Pacifica. And my experience really started as a journalist, and then I started working with communities for councils and local bodies, then coal mining, and Meridian Energy, like resources. But as I got older, I started getting called back to communities, as we all do. And then I realised that actually some of our stories are not being told at the decision-making tables. And so when the pandemic happened, they were calling for people who were used to working with communities at great times of change, especially vulnerable communities. So I started working for health during the peak of the pandemic. And then they told me I had to move into data and digital because the next cab off the rank was Hira. And Hira is about really huge transformational change in the way that people receive their health and disability services. So that's why we're here today. Kia ora.
Talofa. So we're sharing this presentation. Sarona's got a bit of a cough, so if she coughs too much, she's going to step it out, and I'll take over.
And I've been told that if I'm dying on the dais, that I'm in the safest place.
Yeah, we've got a few beds available at the hospital here. So what is Hira? And this is really significant because this is going to impact every New Zealander, 5 million plus New Zealanders, plus the 1 million New Zealanders who are living overseas. So you can imagine all your families that are living in Australia, around the rest of the world. This opportunity will impact every single one of us. So if we think about the Hira program, it is led by the Te Whatu ora Data and Digital, and it is in relation to the challenges around the health sector internationally. So if you think about our workforce, our retiring general practitioners, nursing is moving offshore, telehealth, teleconferencing, all of these things are impacting on the way that we deal with our health and well-being. It will make good quality health information available to you as the health consumer, as the patient. And that is for you to be able to judge where it goes to and consent who receives that. It is one of the several programs within the health sector at the moment that is enabling the health transformation that's taking place right now. So Te Pai Ora, Te Pai Tata, which are the two strategic directional programs. This is one of those programs that is going to enable us to do that well. Hira in its, first of all, Hira is a Māori word. And when I looked at Hira this morning, I realised it was H-I-R, not HIV. And I thought, I better explain that Hira is a Māori word for significant future event or widespread change. So Hira is a Māori word about the future and about what we can do to be a part of that future. The first thing is that Hira is going to be delivered in 3 tranches, and Sarona will go through those tranches as well. But in that first tranche, which is up to the middle of 2024, the focus for us is around our New Zealand patient summary. So that's a minimum viable product, what the digital technologists and technicians and designers and developers called a minimum viable product. This is what we're developing to be able to give access to every New Zealander in their patient information, around their patient information. Hira is creating a platform where consumers can go in and providers can go in and be able to add the information, change the information in a controlled, very secure, private way. And those databases are set all over the place. If you can imagine your own general practice and your PMS systems, you've got Manage My Health, MedTech 32, My Practice, indices, you've got, and they're all overseas vendors. So the reality for us is how do we bring all of that data that sits within primary care, secondary care, in the hospital system? Again, you've got as many programs as you have in primary care, Concerto here, PAS systems. So the reality for us is how do we make sure we're bringing all of that data, and that data has to be quality data, clean data, accurate data about you, and put it into a platform that's secure, private, and able to be accessed by the health consumer. The third thing is a digital ecosystem. So this is where the vendors, the innovators, the people who actually develop apps and web portals and the things like MedTech 32, they're able to go in there and develop things that add to the value of the system. So if we think about those three customers, our health consumers, that's us, our health providers, that's a health system, our health practitioners, and our health vendors, this is a sort of a schematic around what it looks like if the health consumers are accessing their information saying, actually, I'm changing my address, I'm moving, I'm changing my details, I'm updating my information, and I'm sharing it with my daughter. Or my father's sharing his information with me because he wants me to make sure that I'm aware of what's happening. So every one of us has that connection with our whānau or significant other. So if we're thinking about HIV, again, that health information can be consented to go to that person who's a non-family member because that person has decided, actually, you can access my information because I know you're going to look after me going forward. The digital health vendors are creating apps and opportunities for the data sets that are being collected out of the hospitals, primary care, community, Hauora, a number of different places, midwifery, physiotherapists, lab tests, pharmaceuticals. All of that has to sit in the systems that the vendors can access. Again, all of the guardrails around privacy, around security, around access are tripled and doubled up to make sure that that information is safe. And then we have the healthcare providers, clinicians, and half of them left when we got up here. But those clinicians also add value to the information that is being collected. So whether it's collected here in Auckland Hospital or down in Southland, you can access that information and then they will be able to access that information. Currently, the systems don't talk to each other. So you're coming up from Invercargill, or Sarona came from Wellington yesterday. She comes up from Wellington, gets sick. No use Auckland trying to access information for her because Wellington won't release it. And we had a question here this morning about consent from the patient being able to access that information. Again, Hira gives you the opportunity as the patient to give consent online. So again, the digital need is ever increasing in this day and age. So if we think about personal health information, the most important thing in that circle, you are in control of your health information because you know what conditions are and how they are going to be treated. So you're going to be accessing that information and you're going to be talking with your whānau, with your family members. How can this help me? How can we work together to help each other? The ability to view your consolidated health information linked to your NHI. So that's the beauty of New Zealand, is that you've got an individual NHI. But if you're lucky during COVID, like a few of us, you could get 2 or 3 NHI numbers. So there are things that we need to do to clean up the quality of data that we're receiving. We're both from Samoa. My father is from Samoa. Sarona parents are from Samoa. We have Matai names that go before our Christian names. So that Matai name is important to us. And when we change that and our Matai name becomes our first name, that's not reflected in our personal health information because they still recognise me as Manu Sione. So from that sort of scenario, gives you an understanding that actually we have to be able to control our own information and recognise the changes that we're going to make. Your information, I've mentioned this a couple of times, is subject to standards of privacy and security, and we've had a lot of breaches, security, cyber attacks from offshore players, and that's going to continue. So we've got to make sure that all of this information is safe, and there's a lot of guardrails, and we'll talk about that a little bit too.
Thank God, I was going to panic. Sorry, I just noticed that he's had no notes, he's just speaking off the top of his head. I'm not like that, I have to control what I'm saying, otherwise I go off over here somewhere. So how is this different from what we have now? So you get to manage and control your own health information. You get to say who the other people are that can see and access your information. And you can see the people that are looking at your information at whatever time they go in there, where and when. So if people are accessing your information and they've got nothing to do with you, you can ask questions of the health system. Your information is yours, independent of any of your healthcare providers. Currently, you mostly see your health information when your GP shares it with you. But with Hira, your health information will have a wider focus, depending on you. So it'll follow you wherever you go, because it'll be on your tablet, it'll be on your phone, and it'll be one view. And the information will have that wider focus, because we really want to get away from just being clinical. We want you to own it for yourself. And as you know, each of us are very different. And some of us may prefer to go to a fufu. Well, in Samoan it's sort of a massage, but not. It's like a whole wellness belief system. And so for us, it's looking at, for people for whom health is more than just an appointment at the doctor, what might that look like? So you get to eventually do your own personal, it'll start looking more and more like you, basically. So the personal health record, Hira Tranche 1, will be delivered across 3 tranches, basically, because what we're linking up in the background are data sets from different inconsistent pockets spread right across the health sector, and achieving the task of drawing it all into one view in one place is complex and multi-layered. So Te Whatu is doing this in tranches so that it's achievable. And the first one, hopefully, will be completed by the end of June 2024. And what that involves is a personal health record that provides your New Zealand patient summary. And in this summary will be your most basic but important health information, that if you have a medical emergency anywhere, you can access it easily to treat you safely. So this is because your New Zealand patient summary will go with you wherever you go. And if that summary is available, it'll include things like your demographic information, your medicines, your vaccination status, your entitlements. Though we're starting pretty basic on that, it'll just show whether you're entitled to a community services card at this stage. And your lab results, your allergies and your conditions. And what it's attached to is attached to My Health account. And I think you've all had experiences with My Health account. During the pandemic, I know because I was on the end of the phone when a lot of people were ringing me. And that was developed during COVID-19 because we knew that a lot of our stuff would have to be delivered online. So we had to have a process for doing that. So My Health account now has 90% of adult New Zealanders registered already. And you needed to log into My Health account to get your My Vaccine Pass and your latest vaccination status, right? If you wanted to travel. 90%, so with that 90%, it sounds good, but in actual fact, the admittance levels were lower because we were trying to save lives. And so, whereas you'd normally need your birth certificate, your passport and so forth, we just said if you have a Gmail account or an email account, that was good enough. now MHA is going to be what verifies your identity, so we know you are who you are, to keep your information safe. But now it's going to go back to the levels where you do need your birth certificate, you do need your passport and so forth. But the trouble is, of course, we all know that actually a lot of Māori, Pacifica, and people in vulnerable groups aren't registered with GPs, haven't got those sorts of formal identifications. So one of the challenges we have at the moment is to reach into those communities and start talking to them about what other means could we identify that you are who you say you are. Is it that you belong to a iwi and they have records where we could ring your kaumātua and they'd say, yep, I know him, known him all his life, yep, he is who he says he is. Or is it an imam at the local mosque? So it's looking at what other ways can we identify people. And the other thing is consumers can now update their own personal health details. Because at the moment, especially for LGBTQIA+, is your data, a lot of it is either doesn't exist, is incorrect, has the wrong names against it. We know because we heard all of that during the pandemic, and we know we've got a long way to go to fix all that. So why is it important? It's important because we are delivering Te Pai Tata, the interim New Zealand health plan, which focuses on Hira as one of the 5 digital healthcare actions that will help our health and disability system transform in a new direction so that we're enabling the flow and consolidation of information that keeps you at the centre of your own health information. The issue at the moment is your health information is being looked after by people that don't necessarily know you. You know yourself, you know the challenges you're up against. You should be at the centre of your own information. And there's a quote there, I'm not going to read it out because it's very technical and even I found it hard to understand. So, that's it there. Implement Hira, a user-friendly integrated national electronic health record to the agreed level, ensuring blah, blah, blah. There you go. But why is this important? It's important because it's about equity. Not all of us start from the same starting blocks, right? And if we get it right for our most vulnerable communities, we improve it 200% for everybody else. So Te Pai Ora legislation identifies te tiriti and equity as key to the success of us being able to achieve this. And the Hira program will be guided by its equity plan. That plan identifies deliberate actions that focus on areas for Māori of active protection partnerships, so that we're not doing this off assumptions that we make in our heads. We're actually working in partnership with Māori. And rangatiratanga, that at all points we're giving choice and we're giving them the freedom to make those choices. At its heart, the Equity Action Plan encourages Hira leadership to purposefully consider areas of a Hira work program where we can ask questions that advance equity at all points and continually makes positive difference for Māori health. And why is that important? It's important because we want to deliver on te tiriti. We recognise that the current system isn't working for Māori, and if we continue down the path that we are at the moment, it won't work for everybody else either. So the personal health record benefits for consumers is you'll be able to see your own health information and be able to correct and update it. You have the choice to share it with the people that you trust to help you on your health and wellness journey. There's no more repeating of your story because it's there in your hand. And also you can have the confidence that the people that are treating you will have the information at hand, like your medicines, your allergies, in emergencies when you can't speak for yourself. What Hira means for health providers, healthcare providers, is they get secure, easy access in real time of patient information. Because at the moment, if you get sick in Southland and you're from Auckland, they can't see any of your information. So treatment and care decisions based on full, and they get to make treatment and care decisions based on full information at hand. And access to information about a person is all available in an emergency situation if a person can't speak on their own behalf. The other thing is access to comprehensive patient information from existing systems like PMS, clinical workstations, will be available nationwide. And also, patients have the freedom to share their notes ahead of consultations. So where are we now? Oh, hang on.
Yep.
No. What Hira means for digital health vendors. I struggle with this because I'm not au fait with the health vendors. But the MHA will provide authentication and access for users, so vendors don't have to build that as a service. And vendors will be able to access information through standard-based secure APIs that have got guardrails there. They'll only need to go to one place to find those APIs and digital services. So it's, for them, it'll be the Costco of data information that they can then grab and build stuff around. And the other thing is it links vendor apps to the data sources. And that's it, I think.
Can you join me in clapping Sarona? Because she didn't cough once through that whole presentation. So that's a pretty good achievement, really. Thanks. So Sarona talked about a couple of things, you know, the challenges, the complexity, the layers of information that need to go into this Hira program, that need to go into the ecosystem where the data sets will sit and information is secure and private and consents are able to be made by individual patients. This is a diagram of our team. So we have data services, consumer services, and data services about health information that are trusted sources can be accessed through APIs. So if you've got diabetes, HIV, if you've got cancer oncology, radiology, all of that is in different data sets across a number of different providers. So that's one of our services. Consumer services is around access digital channels. Individual and whānau, how do they access that information? Provider services, healthcare providers have secure, authenticated digital channels through which they can access health information. Because you can imagine it, if that information was available to anybody, everybody, there would be, hell to pay. Operational services, identity, interoperability, change and adoption. So there are a number of different teams that are working on this. And we've actually taken the best learnings from, and Mark was talking about Canada and Australia. Absolutely. We're working with those. South America, we're working with the NHS over in England, Europe. There's a number of different organisations that have already done this, and we're coming in, Johnny come lately, but actually this is a good opportunity for us to learn from those mistakes as well. So some of those Hira updates, so we've been going since January 2022. The actual detailed business case was provided to the Minister, the Caucus and Treasury in 2018. It was green lighted by the Minister and Treasury in 2019, and then COVID hit. So it only became active again in 2022. And we've come in now to be able to support this mahi going forward. So some of the things that have already been created is that marketplace. So we talked about how consumers and information can sit on the marketplace, can be changed, can be altered, email addresses, demographics, etc. can be put onto that. The Hira connector plane, so that's where all the APIs sit. That's where all the data sets can be sitting in a secure location, so that when people go in, that information can be pulled out of those data sets related to your NHI number. When we talk about Medicines View, very important part of anybody's health and well-being, all of that is in that system as well, in that first tranche. Product prioritisation, so some of the things that we've had to work on, and again, Sarona talked about authentication. So if you think about My Health account and how in the COVID times you could access information by having level 2 authentication. In this particular process, we will be going to level 3, which is much more challenging for some of our community. So we've got to work with our community about the prioritisation of that particular product. Another product is consent and delegation. So who do you want to have access to your information? How will that proceed? What are the processes that you have to go through to ensure that people are not coercing you to give them your information? So another product that we're looking at is consent and delegation. I think we've talked about notification event management system. So very similar to LinkedIn. If somebody accesses your file or accesses your LinkedIn profile, you get a notification from them saying so-and-so from wherever has accessed your... So this notification event management system is really important because if anybody does access your information, you'll be the person that's contacted and say, so-and-so here from here has accessed your information. Who's that person? Why are they accessing my information? So you're able to then go back to your general practice and say, well, why is this happening? Change in adoption, and that's where Sarona and I work in the group, which is going out to our community. So we talked about Pai Ora, we talked about Te Pai Tata, or the two strategies. Māori, Pacifica, people with disabilities, rainbow community, rural and remote areas, refugee and migrants, young people, elderly people are key populations that we need to make sure get across the line when we're talking about change in adoption with Hira. Some of our communities don't even have a laptop. Lots of them have got phones though. So that's a good starting point. So how do we ensure that we are picking up community champions in our areas to be able to support digital literacy, digital enablement? How do we work with philanthropic trusts like Spark Health, One New Zealand, Skinny, to be able to provide laptops, tablets? How do you use a tablet? My 87-year-old mother-in-law, it's the last thing she wants to be using is a tablet. But she uses her phone. She'll ring up her grandchildren quite nicely. She'll do FaceTime to Australia, to her children over there, to her mokopunas over there. So people have got a real sense since COVID around how to access digital technology. We just need to help them to access for their own information. Then we think about commercial framework, and this is probably the hardest one. We've got all of those vendors from overseas, like MedTech 32, Indices, Manage My Health, Practice 365. So we've got to work with them in terms of the commercial model and what that looks like. Why would they want to give up this information? And they're saying, well, this is our information. We've collected this information. Well, actually, it's not your information. It's your information. You were the people that put that information in there in the first place. They don't own it. So the reality for us is how do we work in a commercial model that's going to support getting this information out to everybody in a platform way so that you're able to use it in your own health and well-being. So any questions that you have, we'll be able to answer here, but also this is our contact details, and we'll be able to triage you. If you remember that slide I showed you with about 7 different teams, technical teams, delivery teams, change in adoption, interoperability. If you've got some real technical questions, like those clinical ones you ask, they'll be able to answer those.
Yeah, and we're also kicking off some research, so if you're interested in being part of the research to look into the whole system, let us